My name is Sira Botes, and I am a dementia specialist and occupational therapist of over 30 years, and I'm also a daughter of dementia. And I am here to help you find hope on the dementia journey. And today I have a special treat for you. We are going to meet the experts, Dr. Josh and Zari Cooper of the Not Your Average Therapy, new company here in our therapy company here in our community. And with no further ado, I am going to ask them to introduce themselves to us.
Hi, my name is Zari Cooper, and I'm an occupational therapist and a certified lymphedema therapist. And a fun fact about me is that I was Sira's student almost a decade ago in home health, and she has deeply influenced the way how I take care of my patients. And so I'm very happy to be here. And the reason why we started our business is because we recognize that the healthcare system is failing, and we wanted to be able to deliver a quality product to the community and be able to help our loved ones in the geriatric population be able to feel confident in their aging process.
Very nice. Dr. Josh.
Yeah, so my name's Dr. Joshua Cooper. I'm a doctor of physical therapy. I'm a board certified neurologic clinical specialist. I know it's a mouthful, but I'm a specialist in the neurological field for physical therapy. And so I'm a co-founder along with Zari here for Not Your Average Therapy. And so one of the reasons we started our business was to be able to have some flexibility, one, with clinical care. We very much value patient care. We understand the value that we can bring to our patients as we work with them, and we do a lot. We prioritize education. And so we understand that value that we bring and the specialized care that we offer. And we just wanted to bring that into the homes of our clients, our patients, essentially so that we can just reduce some of the stressors of traveling to appointments or having to structure your day around appointments, therapy appointments, whether it be, waking up extra early before a work day or at the end of a day, having to try to fit it in. And we understand that can be a little hectic. And so we wanted to be able to, just go right into patients' homes or an environment that they're having some trouble with and provide that same specialized care that you'd get at an outpatient clinic. And so that's one of the reasons why we started it. And we would love to work with anyone that is interested in getting more specialized care at home.
Yes, I love that. So you basically have seen that void in the healthcare, the ever-enlarging void that's leaving our aging population behind, and you're bridging that gap with your services. So that is wonderful and very exciting. And I would love to ask both of you in turn about your passion for the aging population, and especially as it relates to our audience of persons living with dementia and their caregivers.
You want to take that one?
I'll go. So I personally don't believe I've had anyone in my immediate family, but when you have patients, they become your family, and you see them more than you would typically of your family. So it is quite difficult to see someone that you may have seen a couple months ago and then them not be able to do certain things that they've been able to do. So part of my passion is being able to make sure that everyone feels as capable and able to handle the progression of their neurological disease, and make sure that the caregiver feels in control and has the tools to be able to help their loved one as much as possible. That's why we do a lot with education with the caregivers, because the caregivers are the ones who are the glue to it all. Because if someone the patient may remember, but in 6 months from now they may forget. Well, that's why we have to work with caregivers and give them the proper education, because everything's fluid, and they'll be the ones to follow through with it.
Yeah, that is such an important piece that you brought up there, Zari. Josh, did you want to follow that?
Yeah, sure. Yeah, kind of going off of what Zari was saying about caregivers. So just more on a personal level, although not impacted by dementia or any cognitive decline. My mom was a caregiver for my grandmother, who for a very long time, my grandmother lived to be 102 years old. So, so yeah, my mother was a primary caregiver for her. So I was able to see the impact that my mom's presence had on my grandmother's longevity. But also I could see, on the other side, the impact of being a 24/7 caregiver for a loved one, that impact on her own body and her own ability to, just be at her top level mentally and physically, because it does weigh on a caregiver having to always be there to provide for your loved ones. So more on a personal level, that's something that was a passion of mine for this community. And on top of that, my experience with patient care is with individuals with progressive neurological conditions. So not only like dementia and Alzheimer's, but also individuals that have, Parkinson's or progressive movement disorders. And so I've encountered countless, patients and caregivers. And, I understand that it's already stressful enough during this time when you get a diagnosis of, Alzheimer's or dementia. But we also see that transition from an individual being independent. We're talking people that are doctors, lawyers, any occupation, but you live your whole life doing your own thing and being able to take care of yourself. And then now we're starting to notice some changes that don't allow that individual to do that, or the loved one to do that for themselves. So that takes an emotional toll on them, and it is a tough transition for that person as they go through that and have those maybe or maybe not have those moments where they realize like, man, like I've lost a lot of, I can't do things like I was doing before. And so I say that to say it is a tough time going through that transition. And so we understand that. And one of our passions is being able to help these individuals through our business and through the care that we bring through that transition and through that tough time.
Yeah, I love that. So aging in place at their optimal level. Yeah, that's definitely where we have a heart connection, is optimizing their ability so that they can still do for themselves. What a wonderful service you're bringing. Josh, so let's segue into, as an athlete and a physical therapist, you're so passionate about movement. And what kind of tips do you have for our aging population? How can they stay active?
Sure. So in the neuro PT world, we always say a body in motion stays in motion. So really the best thing you can do is stay moving. That can be through walking. It can be through doing yard work. It can be more intense than that. But you essentially want to make sure that you're getting time spent being active and exercising. That there are many different ways you can exercise, whether it's, like I said, walking, it can be biking, it can be swimming, dancing, there's yoga, there's Tai Chi. It's also important to get a good variety of exercise too, not just aerobics. I think we might talk about resistance training and some other things later, but you also want to make sure you're working on balance, you're working on getting your heart rate up, you're working on strength training, but you're also trying to challenge your mind a little bit with brain exercises, which can also be incorporated into, physical exercise. So yeah, those are some things that are very helpful for exercise.
I love it.
Yeah.
So if in doubt, move.
Yes, if in doubt, move, for sure.
And find something that you love.
Yes.
And just keep on doing it.
Yep.
Stop.
Exactly. Find something that you love, something that's realistic, something that is, I would say, convenient too, because if it's not something that is easy for you to do, then I might recommend it, and you might not even do it. Yeah, it's not going to happen.
So that's a great way to talk about aerobic exercises versus strengthening exercises.
Sure.
And even for myself, when I go to the gym, I love running. I do not love weights.
Yeah.
And I always struggle to think about, okay, so how much aerobics do I need and how much weight training do I need in order to stay healthy? So what are your tips for our aging population?
Sure. So I think it was the American Heart Association, they're kind of like one of the leading organizations when it comes to exercise recommendations, because, our heart is what pumps blood everywhere, right? So there's plenty of research out there that talks about a guideline of 150 minutes of moderate intensity exercise per week, or about 75 minutes of vigorous exercise per week. And so moderate intensity simply means you can't be sitting on the couch, just kind of rocking away on your recliner, thinking that that's exercise, but it has to be purposeful. You have to show that you're getting your heart rate elevated. If you're unsure about the exact number to reach, you can always talk with a physical therapist or, someone to get specific recommendations, but you essentially want to get your heart rate elevated. And then you want to make sure you're exercising consistently, and that's challenging enough. Resistance training, you want to try to get that at least twice a week. That can count towards that 150 minutes of exercise, but you essentially want to have a good balance between aerobic and resistance training. And if we can kind of segue into some other things in terms of like, on the science side of things, I'm not a scientist, but I practice evidence-based practice, right? So there's something called brain-derived neurotrophic factor, which is a type of protein that is in your brain, which helps with, it's something called neurogenesis, but basically that's your brain has the ability to create new neurons, and also it helps with neuron synapses, those are basically how your neurons connect to each other. And that BDNF, or brain-derived neurotrophic factor, also helps prevent or slow down neurodegeneration. And so in those conditions like dementia or Alzheimer's, where we know neurodegeneration is taking place, exercise is one of the main ways to increase this protein in order to help with slowing down or trying to get some type of modification of the disease process for these conditions. And so getting consistent exercise, meaning that 150 minutes, try to get that. If you want to break it down to 30 minutes 5 times a week, that's fine. If it's 10 minutes at a time, that's fine. Just try to get a total of that amount per week. And so you'll be able to, have some of the benefits of exercise.
Yeah, that's awesome. And you touched a little bit also on the muscle strength and how that...
That's right. Yeah, thanks for bringing me back to that. So that's kind of going back to with the resistance training, right? So the more you work out your muscles, the more you can maintain your muscle mass. And muscle mass is very helpful for combating osteoporosis. As we all get older, that's something that can be a bit of a concern, as well as having functional strength to be able to do things like get up from a toilet, get out of a chair, get in and out of a car, being able to get up from the ground if you do have a fall, or be able to crawl to get to something if you do have a fall and get up from the ground. So the more you can do resistance training, the more you can maintain your strength and muscle mass. It helps with your functional ability to be more independent. So the aerobic side has benefits, but you also need strengthening as well.
Yeah, to maintain that independence. So good. Thank you, Josh. So good. So what would you like caregivers to know about maintaining an exercise program when they are so busy during the day, having a loved one and taking care of a loved one?
So really just some tips. The exercise in this population can sometimes be, I don't want to say afterthought, but there are a lot of other things that can be right in your face that's more...
That takes priority.
Yeah, that takes priority, right? And so you might not think like, okay, exercise is something extra, right? But really, exercise can be the foundation of allowing an individual to succeed at all their other tasks. For example, if someone is noticing more trouble getting out of a chair, right? And the caregiver is now having to do a lot more lifting to get them out of a chair. If that individual or that loved one was active in exercise or was practicing sit to stands with a physical therapist, or doing exercise, weightlifting with a personal trainer or something like that, or occupational therapist, then that individual wouldn't have to rely on their caregiver as much to get out of that chair. And then the caregiver wouldn't have to stress their body out as much to lift the loved one out of the chair.
Right.
So if you think about it, like if you kind of think about not as exercise being a background.
Investment.
Yeah, it's a long-term investment, but also not being something in addition, but it should be the foundation of a lot of the activities that, someone needs to do. Also, another tip is that, if you can, try to create scheduled exercise, so that way the caregiver has a time that they can schedule around to exercise. It would be nice if they had their own time to do it, but also it's helpful for the loved one to know that consistently, or on this time, on these days, or after lunch or after breakfast, we go for a walk. It just kind of helps to orient them to their day. And it makes exercise a part of their daily routine, which is the more you can fit it into your routine, the easier it is to get done.
Oh, I love it. Yeah, we talk about routine, reminders, and repetition, and doing it the same way at the same time in the same space.
Exactly.
And to repeat that. And so this will help your person to stay anchored and more maybe more willing to participate because they already know what's coming.
That's right.
And it just makes it easy if there's a structure.
It does.
And makes it reliable. Yeah, I really love that. That's such
Less kickback too.
Yeah.
They know it's coming, then you just got to go with it.
Yep. I love it. That's great recommendations. Zari, so as a OT, what are you passionate about in maintaining independence with our patients in dementia? And do you have specific advice for caregivers as this neurodegeneration is happening?
Great question. I think that making sure that the caregiver is taking care of themselves first, making sure that their posture is good and their body mechanics are good during transfers, because if the caregiver is not taking care of themselves and they get hurt, then they can't help their loved ones. So going back to an example, because this is easy for me because I'm a mom and I have a baby, that when we have to take care of someone who really needs most of like us for them to live, we have to raise them up so that it's easy for us to do it. So we have changing tables, we have abilities to bring things to our level so we're not bending down on the ground. Well, if a loved one ends up needing a higher level of care, you think of it the same way. So if you're gonna get them dressed, start them in the bed so that way you're not having to bend down too low. If you feel like you have to bend down, get on your knees versus hinging at your back. If you feel like you need to lift them to physically transfer them, if it feels like that they're getting less and less able to help you, there's machine lifts that you can use to help you with that so that the patient is able to get in and out of the bed, use the bathroom, and out of the shower if you're physically not able to. So I guess the main takeaway is knowing your limitations, that if you don't feel like you're safe or able to transfer your loved one, there's ways to help you with that, such as having therapists come to your home and doing a home assessment and making sure that we can see the environment and give you tips. It could be as simple as teaching you how to position a chair or position yourself, and you don't even need a lift. But using the resources in your community to come and do a home assessment, but making sure that you don't overextend yourself and making sure that you're able to do it as easy on your body as possible so you can continue to help your loved one.
I love that. I love that, as being aware of your own limitations and keep safety in mind.
Yes.
And acknowledging, yes, maybe you can do it in the moment, but can you sustain this?
Right.
And if I can add something
Yes.
to that. So I also think that one of the things I often find with caregivers is that it's easy for them to do something like Zari was giving different great examples, but it's easy for caregivers to do something for the loved one. And so that's great for the caregiver doing it, but it doesn't offer much therapeutic benefit to the loved one, right? So I always try to educate our caregivers on, if you know that you have a certain outing or a certain event or an appointment, try to fit in, if you can, sometimes it's not possible, but try to fit in some extra time so that way you have additional time to allow the caregiver the loved one to be as much a part of that process as possible. So that way the caregiver isn't just doing the activity for them. For example, like getting dressed, like Zari was giving great examples. You would want to have, as a therapist, we would want to have the patient or the loved one be an active participant in that activity. And so sometimes that's not always going to be the quickest or the easiest, thing to do or the easiest option. And if time is shortened, then that can result in the caregiver being impatient or lashing out at the loved one, or creating more of an environment that's not therapeutic. And so having that extra time built in is very helpful to allow for a great use of time and therapeutic intervention for the loved one.
I love that, because increased time also allow you to take a breath. And when we're rushed, we're more likely to injure ourselves. Versus when we have a structure, we plan to have a routine, and we kind of have that awareness of the safety and have that awareness of what that person can do and how to optimize that. So, Zari, can you talk a little bit in the dementia progression about that neuro decline and the impact on motor and coordination as it relates to ADLs?
Yes. So ADLs are activities of daily living, and when we're younger, we learn how to do these things, and then it becomes autonomic and automatic as we get go through our adolescence and adulthood. But as we get older, and if we have a neurodegenerative disease like dementia or Alzheimer's, things start to change. So initially the progression may be, I'm having a little bit more difficulty with having my loved one comb their hair. The movement isn't as coordinated. It just looks like they're having difficulty doing it, or brushing their teeth, things like that. So you may start to notice that as the disease progresses, that they're having difficulty doing things as simple as combing their hair, brushing their teeth, or eating that they've done every day. Their muscles are slowing down and having difficulty doing that. Another example is when you have a neurological disease and it's starting to progress, difficulty with walking, difficulty with swallowing and eating. So making sure that you are able to, like what Josh said, take time to allow for them to be able to problem solve. And it's okay if it takes them 10 more minutes to do something, but also maybe grading your cues, like saying, go ahead and pick up the spoon, bring the spoon to your mouth. They may physically be able to do it, but having those verbal cues may be all what they need. And then as the disease progresses, it may need to be hand over hand when you're bringing the spoon to the mouth, or you show them this is how you comb your hair, and then just mimicking them and mirroring it, then they can do it themselves. So as the disease progresses, it'll change on what you provide to cue them. But we want to have the loved one do as much as they can as possible. So, but that's how some of the slowing of movement and the difficulty coordinating movement can be affected, and what that would look like as the disease progresses.
As the disease progresses. And that's why we love to have our community partners such as yourself that brings services into the home that can alleviate some of these burdens, can help with problem solving, and that support in the home that's so important for our aging population, bridging that gap for them. So that was just so insightful, and we are so excited to have you ready to serve the community. And do you have a website that
we do.
people
Yes.
can see your services? Yes.
Yes, so our website is nyatherapy.com. Not Your Average is that what that stands for? Not Your Average Therapy. And we have an Instagram also, which is Not Your Average Therapy. But if you go to our website, nyatherapy.com, you can scroll down to the very bottom, and you can see our social media. It's a link to about us to get to know us more and all the services that we provide. And you can go to see reviews that other family members have left us, giving their testimony.
I love it. Thank you so much for joining us today. I hope you guys received some nuggets and pearls from these two wonderful therapists. Thank you for joining us. And for more information on Boat's Memory Method, please go to our website, boatsmemorymethod.com. Sign up for our newsletter. Go look at our caregiver resources and support groups. And we are so glad you joined us. Thank you.